Republicans to put
Oh,
that
we're
on?
looking at it very strongly, and we're also going to the Democrats and asking them to do it. The Democrats want to make the insurance companies rich. They're all paid off by the insurance companies. A tremendous amount of the insurance company funding goes to Democrats. Why don't you ask that question of the Democrats? Because I would love to do it. I'd love all of the money to go to the people. They go to the people. You know, I put that out 2 weeks ago. It became #1 viral. People love it. I want the money to go for healthcare, to go to the people and let the people buy their own healthcare through an account. They can buy their own healthcare. And everybody loves it, except for the Democrats. And you know why they don't? Because
So you want to understand the absolute audacity of what you just witnessed, because this is gaslighting elevated to an art form, and we need to unpack every layer of this fever dream, because what Trump just delivered in that rambling word salad is perhaps the most spectacularly brazen act of political projection we have seen in modern American history, and believe me when I say this is about to get wild, because the sheer chutzpah of this man standing before cameras and accusing Democrats of being bought and paid for by insurance companies, while his own party has spent literal decades as the willing foot soldiers of corporate health insurance interests, is so staggeringly cynical that it requires us to stop and really examine the mechanics of this particular species of authoritarian doublespeak. Trump told reporters he's talking with Democrats about a direct healthcare payment plan, claiming he's had personal talks with some Democrats, and he's spinning this narrative that Democrats are the ones enriching insurance corporations when the actual documented reality screams the opposite, and we're going to tear this apart piece by piece, because Americans deserve to know what's really happening here. With less than 6 weeks before key Affordable Care Act premium subsidies expire, congressional Republicans are scrambling to come up with a plan to address the pain of healthcare premiums skyrocketing for roughly 22 million Americans, and Trump has decided that the optimal political strategy is to accuse the very party fighting to preserve those subsidies of corruption. Let's talk about insurance company donations for just one moment, because insurance contributions in the current cycle benefited Republicans with $30.4 million over Democrats' $21.2 million, and historically we know that the finance and insurance sector contributed generous sums to both parties until 2010 when donations began to heavily bias Republicans, which coincidentally was the exact year the Affordable Care Act was signed into law. Now isn't that fascinating timing? Because the moment we got serious about regulating insurance companies and protecting people with pre-existing conditions, suddenly the industry pivoted hard toward the Republican Party. But here's where this gets absolutely bonkers, and you need to pay attention, because Trump's push for a new healthcare plan has stalled amid disagreements within the GOP over the extension of key enhanced ACA subsidies, with the dispute slowing the administration's efforts to avert a looming spike in health insurance premiums. The White House initially expected to roll out a plan last week that paired an extension of the subsidies with conservative reforms, but that was scrapped following sharp backlash from Republican lawmakers who were blindsided by the framework and deeply opposed to its core elements. So Trump is out here claiming Democrats want to enrich insurance companies, while his own administration cannot even get Republicans to agree on preventing massive premium increases for millions of Americans. The GOP has no consensus on how to proceed on the issue, and Republicans say they won't have their alternative proposal to address rapidly rising insurance premiums ready in time for next week's vote, leaving vulnerable Americans in absolute limbo while Trump points fingers. And wait, because it gets so much worse when you understand what Republicans are actually proposing as their alternative vision. Several leading Republican lawmakers have proposed Americans who don't get insurance through an employer should get cash in a special healthcare account paired with a high-deductible health plan, with such an arrangement allowing someone to choose a plan on an ACA marketplace that costs less per month, but comes with an annual deductible that can top $7,000 for an individual plan. Let me translate that for you, because what they're describing is forcing working Americans to gamble with their health by giving them inadequate funds and then saying go negotiate with the healthcare system yourself while you're drowning in deductibles. This is the power to the people Trump keeps shouting about, and it's a cruel joke because the current ACA premium tax credits do not go to insurance companies, but rather go to people to help them pay their premiums for ACA marketplace plans, with people able to either wait until they file their taxes the following year to receive a lump sum or qualify for advanced tax credits based on estimated income. Do you see what's happening here? Because Trump is literally lying about the basic mechanics of how the subsidies work and claiming money goes to insurance companies when it goes directly to consumers to help them afford coverage. The projection is breathtaking in its shamelessness, because ideas like Trump's could rock the Affordable Care Act and potentially lead to its withering or demise, since people with fewer healthcare needs would likely use the funds to buy less comprehensive coverage, leaving sicker, costlier enrollees in Obamacare policies and prompting insurers to raise premiums, which would pull healthy people out of the ACA risk pool and likely lead to a premium death spiral and collapse of the ACA marketplaces. This is intentional sabotage disguised as populist reform, and health policy experts are screaming warnings that nobody in the media seems to be amplifying loudly enough. The law that established HSAs prohibits the accounts from being used to pay insurance premiums, meaning that without an overhaul, the GOP's proposals are unlikely to alleviate the problem at hand of skyrocketing premium payments, with Obamacare enrollees who receive subsidies projected to pay 114% more out of pocket for their premiums next year on average, absent congressional action. Read that again, because Republicans are proposing health savings accounts that legally cannot be used to pay for the very premiums that are about to double for millions of Americans, and Trump has the audacity to say this represents power to the people, while Democrats are the corrupt ones. This is madness dressed up in populist rhetoric, and it requires us to remember history because Trump has been trying to destroy the Affordable Care Act since day one of his first presidency. Let's journey back through time for a moment, because the gaslighting around Trump's relationship with Obamacare has reached surreal levels. Trump and many Republicans vowed to repeal and replace Obamacare, with President Trump signing an executive order on January 20, 2017, his first day in office, that would ease the burden of Obamacare as they transitioned from repeal and replace. And then, in May 2017, the House passed the American Healthcare Act, a bill to undo ACA subsidies and regulations, which was projected by the Congressional Budget Office to lead to 23 million fewer people with insurance, with Trump celebrating its passage in a triumphant Rose Garden ceremony, alongside House Republicans saying, "Make no mistake, this is a repeal and replace of Obamacare." That happened, and we have the video and the transcripts, and now Trump wants us to believe he's the champion of healthcare access. The effort fell one vote short in the Senate, as 3 Republicans, including Lisa Murkowski of Alaska, Susan Collins of Maine, and John McCain of Arizona, joined Democrats to vote it down. Coulters and that thumbs down from John McCain saved healthcare for millions of Americans, while Trump to this day attacks McCain's memory for it. The Trump administration sharply reduced support for advertising and exchange navigators, while reducing the annual enrollment period to about half the number of days, engaging in systematic sabotage designed to undermine enrollment and destabilize the markets. Trump's administration slashed funding for programs to advertise and promote ACA signups, with enrollment dipping the following year in 2018, as he cut outreach by 90% and funding for community-based navigators by 84%, making it harder for people to sign up and actively working to ensure the law would fail. So when Trump stands there claiming Democrats are paid off by insurance companies while Republicans are somehow the people's champions, understand that this represents a complete inversion of observable reality, and it's not accidental, because authoritarian movements always rely on this exact tactic of accusing your opponents of your own crimes. The Democrats are fighting right now to extend subsidies that were enacted by the Biden administration in 2021 and made Obamacare policies more affordable, particularly for low-income consumers who could find plans with $0 or near $0 monthly charges, and for the middle class who became eligible for assistance for the first time, with the beefed-up subsidies helping draw a record 24 million people to sign up for coverage this year. That's what Democrats delivered, and if the enhanced subsidies lapse as scheduled, premiums are expected to soar 114% on average, with a 60-year-old couple making $85,000 potentially having to pay $20,000 more annually for coverage. Trump says everybody loves his plan except Democrats, and you know why they don't? Because they're paid off by the insurance companies. And this is so perfectly Orwellian, because congressional Democrats' refusal to end the government shutdown, unless Republicans agree to make permanent Obamacare's temporary COVID-related tax credits, is intended to protect the health care coverage of millions of low- and middle-income Americans, though an analysis of campaign contributions suggests such support also shields a healthcare insurance industry that gives hundreds of millions of dollars in campaign contributions to Democratic incumbents, challengers, committees, and PACs. Now yes, Jens Reboltum on Medibulers Kambal Pald Paradfeng, Gertauen to Picano Verstenedge Gratingun, that your sopel to mection warge fernti helen helnden, that Jens Paradfeng Pekaraltum Pekan Tench the Pekaraltum Picano Versopel Tamard. Insurance companies do donate to Democrats too, because they donate to everyone seeking influence, but the critical distinction that Trump deliberately obscures is that Democrats are fighting for subsidies that help consumers afford comprehensive coverage, while Republicans are proposing plans that would collapse the insurance markets and leave millions uninsured or underinsured. United Health Group is the biggest healthcare insurance firm in Obamacare, and its political contributions to Democrats far exceed those to Republicans, with $988,411 or nearly 59% of all the firm's donations going to Democrats in the 2024 election cycle, and conservatives are using this data to argue Democrats are captured by corporate interests. But you have to understand the underlying dynamic, because insurance companies adapted to the ACA reality, and now many of them actually profit from the subsidized marketplace, especially as enrollment has exploded to 24 million people. The subsidies flow through to consumers, but insurers benefit from the expanded customer base and the market stability those subsidies create, which means some insurers now prefer the ACA to the chaos of pre-2010 or the uncertainty of whatever incoherent alternative Republicans might produce. So yes, major insurers are donating to Democrats because Democrats protect a system that has created a functioning marketplace, whereas Republicans want to blow it all up and replace it with glorified catastrophic coverage and health savings accounts that won't cover your premiums. This is not the gotcha Trump thinks it is, because some GOP lawmakers, particularly moderate members of the caucus, are keenly aware that many Affordable Care Act enrollees are Republican, with the enhanced subsidies helping spur a record 24 million people to sign up for 2025 coverage, many of them from red states, and more than half of Obamacare enrollees live in districts represented by a Republican. Republican voters are the ones who are about to get absolutely crushed by premium increases if these subsidies expire, and Trump is out here spinning fairy tales about Democrats being corrupt. The concepts of a plan meme has become a cultural touchstone, but we need to remember that Trump's new proposal reveals the absence of a real healthcare plan from Republicans, with Senator Adam Schiff referencing the moment during Trump's debate against Kamala Harris when he was asked if he had a replacement plan for the ACA and said he had the concepts of a plan. It's been 8 years since Trump promised to repeal and replace Obamacare on day one, and Republicans still have nothing coherent to offer, and Republicans have always had trouble coalescing around an alternative healthcare proposal, with some suggesting they might target specific elements of the existing law to show its problems, so GOP candidates in next year's elections can blame the Obama-era law and Biden's enhanced subsidies as major drivers of rising health insurance premiums. This is the strategy because they cannot actually improve healthcare, so instead they will sabotage what exists and then blame Democrats for the resulting chaos. Think about the sheer ideological bankruptcy of a political movement that spent a decade screaming about death panels and government takeovers of healthcare, and now their big idea is to give you a few $1,000s in an account that you cannot use to pay your insurance premiums and tell you to negotiate directly with hospitals when you get cancer. Senator Chris Murphy posted that Trump's suggestion is unsurprisingly nonsensical, asking if he's suggesting eliminating health insurance and giving people a few $1,000s instead, questioning what happens when they get a cancer diagnosis and just go bankrupt. That is exactly what Republicans are proposing, and they're dressing it up as freedom and choice and empowerment when it's actually just abandoning sick people to financial ruin. According to the Congressional Budget Office, health insurance companies received about $92 billion in federal ACA subsidies in 2023, but during the same year, just the out-of-pocket costs not paid by insurance companies totaled $500 billion for Americans, meaning if Trump diverts that $92 billion from insurance companies to individuals, there must be a method to pay for the additional costs of healthcare Americans will incur, as the amount of the subsidies each individual would receive will not cover the cost of a serious illness or accident, leaving people facing major medical expenses to face the impossible for most task of paying those tens of thousands of dollars in healthcare costs by themselves. The math does not work, and Republicans know this, but they're proceeding anyway, because the goal was never actually to improve healthcare for Americans, but rather to dismantle a signature Democratic achievement and return us to the pre-ACA hellscape, where insurance companies could deny coverage for pre-existing conditions and impose lifetime caps, and medical bankruptcy was a leading cause of personal financial ruin. Trump says, "I want the money to go for healthcare to go to the people and let the people buy their own healthcare through an account." And this sounds empowering until you realize that the notion was that if a consumer has skin in the game, they will be more likely to seek higher quality, lower cost care. But the unfortunate reality is that largely has not been the case, with nearly all health plans today coming with a deductible averaging $1,000, $700 for a single worker, with job-based coverage up from around $300 in 2006, and even as deductibles became widespread over the last 20 years, medical prices in the U.S. skyrocketed, with the average price of a knee replacement increasing 74% from 2003 to 2016. High deductible plans paired with health savings accounts have been tried for 2 decades, and they have utterly failed to control costs or improve care, and in fact they have left millions of Americans with crushing medical debt, because a few $1,000s in an HSA means nothing when you face a $100,000 hospital bill. Now let's address this specific lie about the subsidies going to insurance companies, because this might be the most pernicious distortion in Trump's entire rant. The enhanced ACA subsidies are premium tax credits that reduce what consumers pay for their monthly insurance premiums, and the money flows to consumers, not to insurance companies. As profit, insurance companies receive premiums from enrollees, and those premiums are partially subsidized by the federal government through the tax credits. But the insurers still have to provide the coverage specified by law, including the essential health benefits and the protections for pre-existing conditions. The subsidies make insurance affordable for consumers and create a stable market for insurers. Characterizing this as paying off insurance companies is fundamentally dishonest, because the alternative Trump proposes would actually be far more lucrative for insurers who could sell junk plans without ACA protections. GOP Senator Lindsey Graham called the ACA the biggest scam on the planet, touting Trump's proposition to put money in the pockets of Americans to purchase their own insurance plans. But Graham is either catastrophically ignorant about how health insurance works, or he's deliberately misleading people because individual consumers have zero negotiating power against massive hospital systems and insurance conglomerates. The entire point of insurance pooling is that by aggregating risk across large populations, you can negotiate better rates and protect individuals from catastrophic costs. And the ACA built on that principle by creating regulated marketplaces with minimum coverage standards and subsidies to make comprehensive coverage affordable. What Trump and Graham are proposing is atomization, where every sick person is on their own trying to cobble together coverage with inadequate funds, and that is not freedom, that is cruelty masquerading as consumer choice. We need to understand the timeline here because Democrats blocked the reopening of the government for weeks, demanding the Trump administration and GOP agree to extend subsidies under the Affordable Care Act that are set to expire at the end of the year, with Democrats arguing Americans will see their premiums rise without an extension, before a group of 8 Democrats cut a deal with Republicans to reopen the government without winning a concession from the GOP to extend the subsidies. Democrats shut down the government trying to protect health care for 22 million Americans, and Trump is claiming they're the ones in the pocket of insurance companies. Democrats are unified in their demand for a 3-year extension of the Affordable Care Act's enhanced subsidies, which expire December 31st, while Republicans are still divided and debating their counteroffers. And this tells you everything you need to know about which party actually prioritizes health care access. The Republicans cannot even agree among themselves, and Senator Thom Tillis warned that a failure to respond to soaring health insurance premiums is going to be a political problem in next year's midterm elections, with sympathetic cases that Democrats are going to use in campaigns, while Senator Josh Hawley has warned that nearly 500,000 constituents in his home state will be impacted by the expiration of the enhanced subsidies. Republicans know this is going to hurt their own voters, and some of them are terrified of the political consequences, but Trump doesn't care because he's focused on spinning a narrative that absolves Republicans of responsibility when premiums explode. Here's what's going to happen if these subsidies expire and you need to steel yourself, because roughly 2 million fewer people will be insured next year if the more generous assistance lapses, according to the Congressional Budget Office, and premiums are expected to increase by 1,114% on average if these enhanced tax credits expire, with sky-high premiums potentially driving people to risk it and go uninsured, and the Congressional Budget Office estimating that 4 million people will become uninsured in the next few years if the enhanced tax credits expire. Millions of Americans will lose coverage or face premium increases that make insurance unaffordable, and Trump will blame Democrats and the media will both sides it, and vulnerable people will suffer while Republicans claim they were trying to give power back to the people. The cynicism is staggering because 78% of the public, including majorities of Democrats, independents, Republicans, and MAGA supporters, all think Congress should extend the premium tax credits beyond 2025, with other polls finding 72% of voters across political parties supported extending the policy, even for those who had no personal connection to these health plans, because voters don't want to see people losing their health insurance. This is overwhelmingly popular across the political spectrum, and Trump is acting like Democrats are the outliers when his own party is divided, and Democratic voters and Republican voters alike want these subsidies extended. But Trump knows that most people don't understand the complexities of health policy, so he can just say Democrats are paid off by insurance companies, and count on that soundbite resonating more than any wonky explanation of how premium tax credits actually work. This is movement conservatism in its purest form, because for decades the right has claimed to champion free markets and consumer choice, while actually serving corporate interests, and now they have evolved the grift to where they accuse Democrats of doing exactly what Republicans have always done. Campaign contributions from insurance PACs are considered protection money, and your money, with the industry's goal being to keep members perfectly content with a status quo that allows insurers to game the Medicare Advantage program in ways that enable them to collect billions of dollars every year in overpayments, while also allowing them to deny coverage for medically necessary care. The insurance industry does wield enormous influence, and that is a real problem, but the solution is not to dismantle consumer protections and return to the pre-ACA hellscape, but rather to move toward universal coverage that removes the profit motive from healthcare entirely. Democrats should be proposing Medicare for all, or a robust public option, but instead they're stuck playing defense, trying to preserve the compromised market-based system that the ACA represents, because Republicans won't even agree to maintain the subsidies that make that system functional for working people. And Trump has the audacity to claim he wants all of the money to go to the people, when his proposal would leave millions without adequate coverage. You want the money to go to the people? Universal health care where everyone is covered and nobody goes bankrupt from medical bills. That's how money goes to the people, not vouchers and health savings accounts and junk insurance plans. The ideological project here is transparent, because Republicans spent decades attacking Medicare and Medicaid, and now they're coming for the ACA, using the same playbook of claiming government programs are wasteful and bureaucratic, while private markets will unleash innovation and efficiency, except we have decades of evidence that privatized healthcare in America is the most expensive and often least effective system in the developed world. We spend more per capita on healthcare than any other advanced economy, and our outcomes are worse, and Republicans want to make it even more privatized and deregulated, and they're selling this as populism. Trump has similarly signaled his opposition to a simple extension, calling instead for a plan that would send federal funding directly to consumers rather than paying it to insurance companies to subsidize healthcare premiums, repeatedly criticizing the ACA as an unsalvageable disaster. He frames this as money going to consumers versus money going to insurance companies, when that is a false dichotomy, because the current system already sends money to consumers in the form of tax credits that make their premiums affordable. Trump is proposing to blow up a functioning system and replace it with inadequate cash payments and high-deductible plans, and pretending this represents consumer empowerment. And let's be absolutely clear about what happens when Republicans actually implement their healthcare vision, because we saw it during Trump's first term when Trump's administration slashed funding for ACA outreach and expanded short-term insurance plans that do not have to follow the ACA's rules, including coverage of pre-existing conditions, before Democrats won control of the House in the 2018 midterms, in part by campaigning on protecting the ACA. Republicans tried to quietly sabotage the law through administrative actions, and voters punished them for it, because Americans actually like having health care and protections for pre-existing conditions. Only 17% of Americans and about 40% of Republicans polled supported repeal and replace efforts in 2017, with most Americans viewing the ACA more favorably than the proposed plans that would replace it by June 2017, polled so even Republican voters did not support their party's efforts to gut the ACA. Trump concludes by saying his plan became #1 viral, and people love it, except Democrats, and this is pure fantasy because the dissonance between Trump's rhetoric and his plan surprised many conservatives on Capitol Hill, who rejected the idea of voting to continue part of a healthcare law they've opposed for more than a decade. Even hardcore conservatives within the Republican Party are not buying what Trump is selling, because they recognize it as a half measure that doesn't actually repeal Obamacare, while also not protecting the millions of Americans who rely on these subsidies. Trump has managed to craft a proposal that satisfies nobody except perhaps his own ego's need to claim victory. The fundamental dishonesty at the core of Trump's argument is that he presents a false choice between subsidizing insurance companies and empowering individuals, when the actual choice is between a regulated marketplace with consumer protections and subsidies that make coverage affordable versus a deregulated free-for-all where sick people cannot get coverage and healthy people buy junk insurance until they get sick. Democrats are fighting to maintain a system where 24 million people have coverage and premiums are affordable, and Republicans are offering vague concepts that would collapse the markets and leave millions uninsured or underinsured. That's the reality beneath Trump's populist rhetoric. This clip represents everything that is broken about our political discourse, because Trump can stand there and lie about easily verifiable facts regarding how subsidies work and who insurance companies donate to and what Republicans actually tried to do during his first term, and millions of Americans will believe him because he says it with confidence and attacks Democrats as corrupt. The authoritarian playbook requires constant inversion where you accuse your opponents of your own sins and Trump has perfected this technique to where he can literally claim Democrats want to enrich insurance companies while proposing policies that would devastate working families' access to health care. We are watching in real time as Republicans attempt to dismantle a system that provides health care to 24 million people, and they're doing it while claiming to be the champions of ordinary Americans against corrupt Democratic elites and corporate interests. This requires a level of cognitive dissonance that should be unsustainable, but Trump understands that if you're shameless enough and repeat the lies often enough and attack your critics viciously enough, you can reshape reality for enough people to maintain political power. Trump has continued to push aides to develop a health care plan over worries that voters will blame him for rising premiums should he fail to present an alternative, with Trump insisting that something's going to happen, though he acknowledged it was far from a sure bet and probably not going to be easy, so even Trump knows this is a disaster in the making, but he's hoping to survive long enough politically to shift blame. The stakes could not be higher, because we're talking about whether millions of Americans can afford health care and whether protections for pre-existing conditions survive, and whether we continue the slow progress toward universal coverage or whether we regress back toward the catastrophic system that existed before 2010. Trump is framing this as corruption versus populism, when it's actually about whether government should help people access health care or abandon them to market forces that have proven brutal and inefficient. Democrats need to make this case clearly and forcefully because the alternative is letting Trump's gaslighting define the debate, and when that happens, millions of vulnerable people lose. This is the fight, and these are the stakes, and Trump's accusation that Democrats are paid off by insurance companies, while he proposes policies that would collapse coverage for 22 million people, represents the pinnacle of right-wing projection and authoritarian doublespeak. We cannot let this stand unchallenged because healthcare is a human right, and the Affordable Care Act, however imperfect, has saved lives and protected families from bankruptcy and expanded coverage to millions who were previously uninsured. The Democratic Party needs to defend this legacy while making the case for going further toward true universal coverage, because half measures and defensive crouch politics will not cut it when facing an opponent as shameless and aggressive as Trump. The future of American healthcare and the well-being of millions of families hangs in the balance, and we must fight with the moral clarity and urgency this moment demands.